I think people will be reassured to hear that the government does have a plan B as we move into autumn, winter. Maybe slightly surprised that we're calling it plan B, but to have one is certainly advantageous. But given the briefing we had from the Chief Medical Officer yesterday, given the minutes from SAGE from a week ago, which were released yesterday, warning of 7,000 hospitalisations a day, why are we not moving to plan B immediately?
Well, look, what we set out yesterday were our plans to manage COVID over the autumn and the winter. We know that's the time of year that COVID-19 likes and other seasonal viruses like flu. So I think it's right for government to reassure people that we have planned for this. Our first line of defence against COVID remains our hugely successful vaccine programme that's complemented by amazing new treatments, by our juggernaut of a testing system, our world-class surveillance system. And this is all working, and that's allowed us to make the gains that we've seen over the last few months and return almost to normal. And alongside that, by the way, we are also going to have the biggest flu vaccination programme this country has ever seen, so we need to work and continue to plan for that. We also want to increase vaccine uptake. That's going to help over autumn and winter, and that's why yesterday I also announced that we're going ahead with a booster programme for some 30 million people starting next week, and we're also offering vaccines to 12 and 15-year-olds. So I think taken together, this can protect the gains that we've made. We've got to remain cautious, of course, but I think that's a good plan A.
All of which is entirely laudable, but we knew all of that. So the question remains, why are we not moving to more stringent measures now? If we do nothing, if behavioural patterns do not change, if action continues, then we are on track to see hospitalisations increasing significantly in the next couple of weeks.
No, I think you might be there referring to the SAGE report that you just mentioned. Obviously, there's other reports and things, and it's right that experts are looking at what's happening and trying to come up with their best guess of where things might go based on certain assumptions. Now, my job as the Health Secretary and other ministers is to take all of that together and make the best decision that we can. I remind you that back when we made the Step 4 decision, there were also experts saying that case rates are going to surge to 200,000, that hospitalisations are going to go 2,000 to 3,000 a day. Don't do it. But we have to listen to that, but eventually make what we think is the right decision. And there is no risk-free decision. But I think what we've announced in terms of this plan is well thought through. It's the act of a responsible government to set out, this is our plan, this is how we're going to protect the gains. But just in case things are not quite as we would want them to, we've got to have another plan and get that ready too.
Completely agree that there are no risk-free options, but there are riskier options and there are options which are less risky. It does rather feel that we're in the same situation that we were this time last year, when SAGE were again warning that there needed to be some kind of intervention. The government dithered and dallied for 2 months before we got the lockdown, and we know what happened December and January in terms of hospitalisations and deaths.
Yes. And I think the big difference, this is huge, are the vaccines. I mean, the vaccines are working. We know that they've already stopped some 125,000 deaths, some 140,000 hospitalisations, some 25 million infections. And that is why we also want more people, as part of our plan, to take the vaccine. There's some 6 million adults out there that still haven't had a single jab.
And we may well have been better spending the summer trying to get as many of those vaccinated as possible.
And I think it's great that we have got to 81% of adults having had a jab.
Your colleagues have always said, did previously say, that the vaccination programme was the way out of this. And clearly that's not the case anymore.
Well, I think if we all look at where we are today versus even at the start of this year, we've made huge progress. And the reason for that is the vaccines. Now, it's not just the vaccines on their own. We can't just rely on the vaccines, and that's why the new treatments that we have in the NHS is hugely important as part of our defence. Our testing system, where our offer of a free test, that is identifying some quarter of the positive cases that we see on a daily basis. And so when we get those people to isolate, that helps protect not just them, but those around them. Our surveillance system, it's the best in the world in how we now can better look out for and track any new variants, and especially those that might concern us. So taken together, that's a very strong package. That said, and if they are implying this, I would agree with this bit, is that we need to make sure that we've also got plans in place just in case, for example, there is a new variant of concern, let's say highly infectious, has some kind of vaccine escape capability. We've got to prepare for that and have things ready to go just in case.
So it is a new variant the trigger point for a move to Plan B?
No, I wouldn't. I would. I mean, a new and dangerous new variant, would be of course of huge,
clearly,
significant concern. But it doesn't. There could be other issues. So, for example, what happens in the NHS is going to be hugely important to me, to the whole country, making sure that we don't get to a position again where the NHS becomes unsustainable.
Well, what level of hospitalisations would be unacceptable then?
Well, I think we're going to have to look at a number of measures, which we already do, working closely with our friends in the NHS. So, of course, that would be the level of hospitalisation. It would be the pressures on A&E, the pressures on the workforce. So we'd have to take all of these together and obviously on a daily basis, talking to our friends in the NHS to see how they are coping with pressures. Now, we know at a winter time, even in a normal winter, without COVID, it can get very tough for the NHS. Now we've got to layer COVID on top of that, and going into this winter, I think we just want to be as best prepared as we possibly can.
Do you now accept that you were wrong to say back in June that the relaxation of restrictions was irreversible? I mean, messaging at times like this, particularly in a public health crisis, is all important. Your words will have had an effect on people's behaviour.
Look, like anyone else, as we remove measures, I want it to be irreversible. But as we've said now...
You didn't say that. You said it was irreversible. Do you accept now that you were wrong to state that the messaging was wrong?
I want them to be irreversible, and I think that what I was expressing then and what many people have expressed, a desire that we just keep moving forwards, that we don't have to go backwards into measures that we'd wish we'd just said goodbye to. But I think we just have to be remaining cautious. And I think what we set out yesterday as a government, our plans to keep up with the vaccine programme, to keep up with the testing, I think these are the good, solid measures. But we've got to continue to work together as a country to protect the gains that we've made.
Sure, but I think the problem is that the messaging seems to veer between one point in the day completely cautious, the other end of the day completely optimistic. I mean, let's just take one of the aspects from Plan A as outlined by the Prime Minister yesterday, the advice that we should now be wearing masks in crowded places, masks in indoor situations, masks when people requested of us, according to Chris Whitty. When you and your cabinet colleagues met yesterday to discuss and sign off on what the Prime Minister said, how many of you were wearing masks? You can take a look at the picture that we've got. The number 10 released yesterday, that they chose this picture. There's basically, 38 to 40 people in that room, poorly ventilated. Not one person is wearing a mask on the day that you advise us to wear masks in situations like that.
And that is perfectly consistent with what the Prime Minister said yesterday and what I said yesterday, because what we said was that people should consider wearing masks in crowded places when they are with strangers, when they are with people that they are not normally spending time with.
So we'll expect the Conservative backbenches to be wearing masks at PMQs later
today? No, they're not strangers. This is the Conservative backbenchers, whether they're in Parliament, in the chamber itself, or in the other meeting rooms and things.
Can you not catch COVID from your friends?
You have to take measures that are appropriate for the prevalence of COVID at the time. And with the measures that we've taken with vaccines, with testing, with surveillance, and sensible use of masks when required, and as we've suggested yesterday, which has been perfectly consistent, by the way, with what we said at the time we entered step 4, we took that step, and what I said at the time about masks, what the Prime Minister said, that hasn't changed. And so that messaging has been consistent throughout, and it's important that we set out, as we have in this plan, about how we can work together to protect these gains.
Do you think more or less people would wear masks if they saw you wearing them around the Cabinet table?
I think, look, of course, people are influenced by others, but every individual should make the decision based on the advice that they're given and in the situation they find themselves in at the time.
I mean, there is plenty of misinformation and disinformation around, and you're absolutely right to point out that people will take their lead from others. Nicki Minaj made some pretty baseless claims on social media. I'm not going to ask about those specifically, but I do wonder whether or not you feel the social media companies are doing enough. That tweet by Nicki Minaj remains up this morning.
I don't want to draw attention to such ridiculous tweets, but the people that are in the public eye, whether they are a celebrity or a politician or whatever they are, they should be very careful with their language and certainly should not be spending untruths. And I think what the chief medical officer said was absolutely right.
I think everyone would agree with you that people in public positions should be very, very careful with their language. I do wonder then what you make of the comments that have come to light. Michael Gove, not when he was a student, as some suggested, but when he was in his 20s, he used the term fuzzy wuzzies to describe black people. What is going on in this government? What should happen to him?
Look, I don't know anything about that particular report, whether he
made
did
homophobic
or
and
he did
racist
not.
remarks at the
I don't know whether he did or did not say that. What I do know, I didn't know Michael Gove in his 20s, but I do know him now, and I think you'd find it hard to come across anyone in the government that is so inclusive and celebrates the kind of Britain that we are today.
Sure, but if a member of the English cricket first 11 had made those remarks in his 20s, he'd be ejected from the side and he'd be suspended from cricket. It feels like the bar for acceptable language for a Minister for the Crown is lower than that for a guy who hits a ball with a bat professionally.
Look, I don't agree with you. As I said, I've told you with my experience of Michael Gove, I think we're lucky to have him and everything that he does in government. It makes a huge difference every day. But in terms of those particular remarks, obviously, I didn't know him in his 20s. I'm not even familiar with that particular report, but you could try and invite him on your programme and see what he has to say.
I accept you won't be drawn on that. I do want to conclude on the decision by the Speaker of the House of Commons to, in essence, ban the Chinese ambassador from speaking. From a political standpoint, do you agree with that decision?
Well, first of all, it's a decision for Parliament. Sure, it's not a government decision.
What do you make of it?
I think that, given that the Chinese government has banned British parliamentarians, I find that unacceptable. It is absolutely wrong for the Chinese government to ban British parliamentarians and for calling out the gross human rights violations that take place in that country. And that's and I can see why Parliament, represented by the Speaker and the Lord Speaker, might have made this decision.
Minister, great to have you on the programme. You've got a very busy day, so we will let you go.
Thank you very much. Thanks for having me.